And we're here from coast to coast, from New York to California, from Michigan down to the Texas Panhandle. You are listening to the Healthcare Business Network at hbnradioshow.com. That's hbnradioshow.com, where business and healthcare is our business. I am your host, Ron Nyman. I want to take the opportunity to welcome all of you out there who are listening to us today. We have another exciting show lined up for you. And we're going to be talking about healthcare reform today, which I know is a subject near and dear to many of your hearts out there, of course, otherwise known as Obamacare. And today we have an excellent guest who has an unlimited amount of expertise in this area. His name is Bill Finerfrock. Mr. Finerfrock is the Senior Vice President of Health Policy at Capital Associates. Capital Associates provides government relations, consulting services for a variety of health-related clients. And Bill's areas of expertise include managed care, healthcare financing, health system reform, health workforce, and rural health issues. Bill has worked in and with the U.S. Congress and federal agencies for more than 30 years. He began his political career in Washington in 1976 as a Lyndon Baines Johnson congressional intern for Congressman Bob Edgar, who's from Pennsylvania. And between 1977 and 1984, Bill worked for Senator Edward Brooke from Massachusetts and Senator Roger Jepsen from Iowa. He is a 1977 graduate of Penn State University, and from 1985 through 1993, Bill was Director of Federal Affairs for the American Academy of Physician Assistants. He has been working with the Healthcare Billing and Management Association for more than 10 years. In addition to his work with HBMA, Bill works with a number of other health professional associations on their legislative and regulatory issues, including the American Society of Radiologic Technologists, the American Academy of Professional Coders, the National Organization of State Offices of Rural Health, and Bill is also the co-founder and executive director of the National Association of Rural Health Clinics. And as I said before, over at Capital Associates, Bill specializes in so many of these areas that draw upon his background, areas that include, as I said before, healthcare financing, health system reform, health workforce, and rural health issues. I want to take this great opportunity to welcome Bill Finerfrock to our show. Bill, welcome aboard.
Thanks, Ron. I appreciate the opportunity to talk on your show today.
Well, it's great to have you. Well, where do we start? I mean, this is a big issue, a very well talked about issue. A lot of people talking about it right over their dinner table. At this point right now with healthcare reform, otherwise known as Obamacare, where are we at right now with regards to the GOP Republican effort to repeal Obamacare?
Well, it's a good question. I think that it's something that's probably on the minds of a lot of folks. Where we are right now is that the new Republican Congress a couple weeks ago took up the repeal legislation to repeal the Patient Protection Affordable Care Act, which is healthcare reform, or as you refer to it, Obamacare, and passed by a fairly overwhelming majority a bill to completely repeal that legislation. There was one Democrat who crossed the lines and voted with the Republicans to repeal, which I suppose some would say was the first bipartisan vote on health care reform, given that when the bill passed in the House, it passed exclusively with Democratic votes. The Senate then subsequently, through an amendment process, the Republicans attempted to take up the health care reform repeal legislation. They offered it as an amendment to another pending piece of legislation, and that amendment was not successful. Again, basically on a straight party line vote, all 47 Republicans voting to repeal the Patient Protection Affordable Care Act, all Democrats who were present and voting against repeal. There were two folks who missed the vote, so they failed in that effort. So right now, statutorily or the outright legislative repeal of the Patient Protection Affordable Care Act is pretty much a dead issue.
So that brings me into my next question here. with a divided government, because essentially you have a Republican House, right, a Democratic Senate, and of course the executive branch being run by the Democrats. Does the GOP really have any leverage here to change or abolish Obamacare?
Well, there are a couple of different ways. I think you do have to look at the issues separately. One is, can they change the legislation? And I think certainly that there is an opportunity to change the legislation. We've already seen, for example, there was a provision in the legislation mandating that all employers would have to file a 1099 for all invoices in excess of $600 and create a tremendous amount of paperwork, a lot of cost to businesses. And the President and the Senate and the House have all said that provision should be repealed. The Senate has already voted to repeal. The House began considering legislation to repeal the 1099 provision this week. It's expected to consider similar legislation, and we're anticipating that would make its way to the President's desk. So while that's a fairly small provision from a bill that was rather large, it's not insignificant to the business community, the Congress is coming together to change that. I think that there are other opportunities for making changes to the health care reform legislation. The President has already indicated a willingness to consider some new liability reform ideas, possibly looking at some other reform kinds of initiatives. So I do think that there may be opportunities for change in the legislation as we move forward. How significant those changes are, I think individuals would have to, how they might interpret some of those things would, differ. But I do think that there is an opportunity for change to the healthcare reform legislation. I think the other aspect of this that cannot be overlooked, and as we're speaking here, the House is debating now what is called a continuing resolution to fund the government through the remainder of the current fiscal year. The last Congress failed to enact any appropriations bills, and so the government currently operates effectively extending the end of the fiscal year right now till March 4th, whereas it should have ended on September 30th. One of the key components here is that with the House going to the Republicans, they have a very major role in the appropriations process. All legislation, for those of you who remember, you're back to your Constitution days and how our laws are made back in high school civics, will recall that all bills dealing with the raising and spending of money must originate in the House. And so that means all appropriations bills originate in the House of Representatives, and they have a significant say in how monies are going to be spent. Well, in order to carry out the health care reform legislation requires an appropriation. It requires money to pay the salaries for the people at the Department of Health and Human Services who will be responsible for writing the rules and regulations to take the health care reform legislation and make it enforceable. It'll require writing of guidances. It will require the establishment of new offices. And those offices will have to have staff. All of those functions come about as a result of appropriated dollars. And the Republicans in the House have already taken, in the current continuing resolution, incorporated a number of provisions to eliminate the funding for much of those activities. So they can have a significant say. Now, Senate certainly still has a role in the appropriations process, and it's up to the President to sign or reject an appropriations bill, and that could set up some very significant showdowns. But, the other tool at the lever available to the Congress is this ability to control the purse strings, and as a result of the ability to control the purse strings, have a significant impact on how quickly or slowly and what may or may not go forward in the way of rules, regulations, et cetera, to carry out the health care reform legislation.
So it's the old saying when we were kids that the President has the power of the pen, but Congress in this case has the power of the purse.
There you go.
So divided government, even as envisioned by our founding fathers, is on display today.
Absolutely.
Well, listen, we're going to take a short break, Bill, hear from our friends at MediStar. But when we get back, we're going to talk about the court challenges to Obamacare and what kind of impact it's going to have on the law. We'll be right back here on the Healthcare Business Network in a moment.